Hello everyone, I am Amita from Nourish Talk, a platform for natural and holistic therapies. We are going to be talking about kids' health today, a natural medicine for kids. That's what the topic is, and we're going to talk with Sandi Ross. Sandi Ross is joining me from Australia right now. Sandi specializes in nutrition, naturopathy. There you are. Hi Sandi, how are you?
I'm good, thank you. How are you?
I'm doing great. Yeah. Well, welcome from Australia. It's such an amazing thing for you to join us live all the way from Australia.
And good timing too. The rain has just stopped. So as you can see, my hair is soaking wet. And we've literally just had about an hour of torrential rain. So very good timing.
Great, great. Well, to everyone who's logging in, we are talking about natural medicine for kids, for babies, actually, for kids. So that's the topic today. Very fascinating topic. And Sandi is a professor at one of the universities in Australia. Maybe you can tell us a little bit about yourself and then we can go into the questions.
Sure, okay. So I originally studied naturopathic and Chinese medicine when I finished high school. So I graduated with the 2 degrees when I was 22. So I got into it from a very young age, and I was very fortunate to go and work actually abroad, working in Bangkok in Thailand. And it was when I was in Thailand, I was exposed to so many cases of children with allergies and atopic conditions, anxiety, sleep disturbances, all those sort of things that we see commonly with children. And so that's where I really got to utilize everything that I had learned for years.
Mhm.
And one thing I found with children, it was a very different approach to treating it. And Chinese medicine has a really nice way of integrating and working with children because it looks so much at the energetics and the emotional aspect of treating a child. And so that can come along back to the mother. And so with Chinese medicine, when we work with kids, we look so much about the emotional health of what happened, in the pregnancy, in the labor, the early years of the child. Was there probably attachment with the mother and all sort of stuff. So just integrating the Chinese medicine with the naturopathic medicine, which is, genetic testing, functional testing, microbiome and everything like that. I really found a great combination of working with children, and somehow to attract a lot more children to my clinic. And I also do a lot of women's health as well. And then when I moved back to Australia, when I was pregnant with my daughter, I started working at Endeavour College of Natural Medicine, so one of the leading colleges here. And I've been teaching pediatric Chinese medicine department for, I think, 4 years now. And that's been really great to really dive deep into the Chinese medicine aspect and utilize tools that we can actually apply and give to mothers to do things at home, while also integrating, that naturopathic aspect, which is, gut health and diet and the emotions. And yeah, so the combination of the two modalities to work really well with working with one. And that's from birth till 7 usually when we're looking at children.
Got it. So you mentioned a lot of different things. Like you said, you're using the testing of the naturopathic medicine and with the Chinese medicine. So just tell us a little bit about the detail part. So let's say you said 0 to 7 years. That's another thing. So let's say I'm 2-year-old. So you do a test for the baby, for the toddler, and then you will prescribe herbs. Is that what happens?
No, not always. Every child's different. It depends on the severity of the case too. So sometimes I see, babies for colic or constipation or sleep disturbances, and we might be able to use, gentle acupuncture, which is a technique we can talk about. Maybe give dietary advice to the young child, or if it's a breastfeeding mother, to the mother. Maybe use some probiotics and that sort of thing. And sometimes that's enough. Obviously, if it's a more chronic condition, working with behavioral stuff, ADHD, or more autoimmune diagnosis, then often, and type 1 diabetes is actually a common one I see with kids. Then what we'll do, excuse the rain, I hope you can hear me okay. Then I might use more functional medicine. So I want to know a little bit about the genome of the child. So we might do genetic testing. I might do microbiome stool testing to find out about the bacteria in the gut and if there's any parasites. Because worms is a big one in children too. So I'm always looking at it from the child, we need to go with the child, where the mother's at with things as well. But often in the younger years, we're treating the mother alongside the child too. So that comes into it massively.
Okay. So what do you use for little babies, like the newborns? And I mean, do you tell us? I mean, I know you use a simple, different kind of a Japanese therapy called Shani Shin, which none of us know what it is. So maybe you can tell us, how do you take care of little babies when they're born or even newborns?
Sure. Okay. So Shoni Shin means little child tool. So it's actually like a tool. It's a there's a few different. There's actually quite a broad range of the different tools we use.
Yeah.
And we use it like acupuncture for baby. So there's no needle, no actual going in and actually poking the baby, but instead a very gentle approach along the meridian. That works very similar to adults having acupuncture. But I tell you what, I think it's a lot more effective and works quicker than acupuncture, because I've seen some amazing things come, one or two treatments change the whole perspective of things with children's health. So when there's a little one coming to me in clinic, obviously if it's online, I don't do it, but I might tell the mum how to do a few things. Yeah. And so I'll be using this technique, and it only takes 5 minutes, so it's very quick. And if their mother's breastfeeding, I'll often be prescribing things to the mother and treating the through the breast milk, because often we see, especially in those first few months, that there's a problem arising from a deficiency in the mother, correlating in the baby's health. So we treat it that way, while obviously giving a gentle treatment to the baby. I will give probiotics to young babies as well. I have this problem with prescribing probiotics. I really try and withhold from giving anything before the 6 month of age, sort of before they started having food. I really don't like to give any herbs and stuff, because a lot of herbs are very antimicrobial, and that can also disrupt the gut bacteria. So if they do need something orally, then I'm looking more so at homeopathic medicine for young ones. And then obviously once they're eating, I might give herbs. It might be just gentle droplets into the mouth, more that sort of stuff. And always using nutritional medicine as like a ground level to work with, because Chinese medicine has an amazing perspective on the diet, and understanding the energetics of the Chinese medicine diet can sometimes shift so many things with kids. And it's so often we see, a child that comes in, they're around the 9 month age or 2 years or 3 years. And when we trace it back to when the eczema arises, it's from when they first started having an introduction of foods, go to what foods were, and they might have been too cold, or the kind of wrong energetic constitution for that child. And so I see a lot of problems coming from when children start having their solids introduced into the diet. That's a big area, I have to trace back and work with a lot, because, smoothies are a big thing here too. Everyone's giving smoothies to kids, and too much raw and cold things. And children have a very weak digestive system. In Chinese medicine, they actually say no cold and raw food for children, because they're they don't have the ability to break down food like we do. Yeah. And so we encourage, more warm and cooked style of eating, unless obviously it's a very hot day, a little bit of fruit and all that sort of stuff. That's totally fine. There's no limitations with fruit. It's just don't serve things cold from the fridge and freezer, like in a frozen smoothie to your child. So yeah, that's just a few things we kind of do with the younger ones in their second, third. Yeah.
So let's talk a little bit about a lot of babies, right? When they're born, they have most of them, they have a problem sleeping through the night. I mean, a lot of young moms would say, oh, my baby's now having problems sleeping through the night. So do you have like what kind of natural methods or herbs? I don't know if you can't use the herbs, obviously. So what can you do to help babies sleep through the night?
So first of all, I'd be looking at the age of the baby. If they're still quite young, it's whatever's happening with the routine and the breast milk and the whatnot, because they do need a wake. Unfortunately, and I've got 2 young kids that haven't been great sleepers, but I've managed to work with a lot of kids along the way to help them sleep. So I always laugh at, why can't I help them sleep? But habit comes into it a lot. So if you're working with a baby that's still in the months of age, then feeding times and all that sort of stuff is massively going to come into it. And so you can work obviously like with a sleep consultant, a gentle sleep consultant, to try and establish a better routine for children to sleep. That's important, because if it's habitual and environmental, no substance is going to change that. And so that needs to be looked at from that perspective. However, when they're a bit older, after a year of age, they should be sleeping a bit more. Then I look at it from a couple of different perspectives. So one is from the Chinese medicine perspective, and children in Chinese medicine are very yang, so they have a very hot energy already. And a lot of mothers will know this, that their kids are kind of kicking off the blankets and throwing off everything, and they sleep naked, anything like that. So they have a lot of heat arise in the evening, and that can disturb their sleep. And so this is where the Shonishin technique is really good, because that clears a lot of the heat out of the system. And so one other thing can be that in Chinese medicine, we see a lot of conditions with heat arise from stagnation or stagnations of emotions. And so if your child's having foods that aren't digesting properly, then they accumulate into heat. Then that'll cause the rise of the heat and disturb the sleep. So sometimes it can come back to diet, and you know that can shift a lot of things. When we get the diet right and the bowel movements and everything, we see a ripple effect on how that can change behavior and sleep. Naturopathically, I use herbs and magnesium and stuff like that, but a lot less in younger years. We're not really trying to stimulate any of those melatonins or either sleep neurotransmitters and their cortisol levels shouldn't be that out as well. So we are trying to look at it a bit more from a gentle perspective. But one thing is iron deficiency has been associated a lot with sleep disturbances in children.
I see. So that comes to the next topic, is the common nutrient deficiencies in kids, and you said iron is one of the ones. And so now then you will tell the mom to eat more iron-rich foods because she's breastfeeding, so that the baby can get that, right? Or if it's a toddler, then you'll give them some kind of a herbs with the iron-rich, or the solids with the iron-rich foods. Is that what?
So, yes, if they're breastfeeding, I'll definitely look at the iron stores. And so I'll be often testing, checking their ferritin, which is more the stored iron, and looking at that. And, if they are deficient, then we're obviously prescribing supplements for the mum, and then also looking at the diet. But I always will be prescribing supplements, because if they're already deficient, it's very hard to build it up from a dietary perspective. So we use diet as maintenance, but we might have to build it up via supplementation in the beginning. And, sometimes do need to send people off for an infusion, not always, and that's a very last resort, but that can actually make a big shift. It's very hard for a mother, if she's also very anemic as well, to have the energy to look after a child. So iron is one in the younger kids. So in the diet, we've got fussy eaters. It is sometimes common to have an iron deficiency. So kids with an iron deficiency, they're often quite pale. Be quite tired. They can have problems with their sleep. They can also have problems with focus and attention and behavior. And so I will often try and work with the diet first to build that, because that's obviously going to be educating the mum and the child to eat. And so there's two forms of iron we look at, and that's the heme iron and the non-heme iron. And the heme iron, which comes mostly from your meat, is a better absorbed form. And so if you're working with vegetarians, it's timely and whatnot, but the way the meats are cooked is really reflected in their absorption. So, slow cooking meats and cooking things in water, things that are really easy to break down. Sneaking a bit of like liver into children's food is a great way to build their iron stores really quickly. And they don't taste it you only need a very little bit as well. But it's a very nice little trick to, put in with their mashed potatoes or something like that if they're quite fatty. And then if you're doing the non-heme form, so you can use things like your beans, your lentils, your legumes, soaking them and cooking them, almonds and cashews, all your leafy greens. Ideally, the heavier like kale and chard and spinach, you cook them, because then you can actually break them down and digest them. Black apricots and dates are a great form of iron for kids as for foods as a little snack.
Oh, that's a snack. Oh, that's really good information. Anything else you'd like to add? This is a lot of good, amazing information. And I hope young moms are watching this. If they're not watching it right now, they can watch it after it, and learn from how to take care of their newborns or even small toddlers. There's
quite a few common deficiencies we do see a lot in kids. So I can touch on a couple of them if you like. So zinc is another one we see deficient, and that creates fussy eaters. And so we can actually, naturopaths can do an oral test in clinic to see if there is a zinc deficiency. And they don't need a huge amount of zinc in their diet, but they definitely need some. So meat does come in through things like seafood, and also zinc through meat and also seafood. And then your nuts and seeds are a great form of zinc as well. Calcium. So I see a lot of mothers get really anxious about the calcium intake for their kids, and if their bones are growing and if they're going to be tall and whatnot. And everyone is very quick to try and, push cow's milk into their children. And some children do okay with cow's milk, but a lot don't. And you got to remember that the proteins in the cow's milk are quite large, and so they can actually disrupt the gut and create problems within the digestive system. And also proteins are often competing with the calcium for the absorption. So a little bit's okay. And there is a lot of calcium in the dairy products versus the vegetarian sort of stuff, but it's the ability to absorb it. So, you know, even kelp is a really good source of calcium. And hard-boiled eggs, because calcium phosphate from the eggshell goes into the egg. Another great, and eggs are a great as well. Your seeds, they're really rich in calcium, like tahini is one of the ones for kids. Put that on some great toast with some honey, and kids love that as well. And yeah, calcium is one of those ones with the deficiency we don't really see till later on, because it's very much in the bones and in the teeth. 1% is found elsewhere in the body, but yeah, that's the main concern there. So something we don't really recognize deficiency until it's become quite chronic. Sorry, I think I moved from zinc to calcium then, didn't I? Yeah, I did. So sorry. So your zinc for your seeds and everything like that, and I moved into your calcium. So your calcium's another one we see a lot of deficiencies with mothers concerned. No, I did say on that. Sorry. But
you did say on that. Yeah.
Looking at the bone health with that, and then another one which I need some more of, which is for IQ and brain. And this was one we get a lot of deficiencies with breastfeeding, which I'm still doing actually, is iodine. It's a common deficiency we see a lot in women and also in children, because we're not really getting those food sources into our diet. So iodine's more found in things like the kelp and the seaweed. So if you're not eating those foods, you're probably not getting the iodine diet. And so I think kids love sushi, so that's a great little snack and food to be consuming for kids to get the iodine intake in. But if you're not getting your daily intake, then you should be supplementing, because it's a very important nutrient. And you can get those little wakame flakes, and you can pour them on food and stuff like that. And they taste quite good. And the earlier on you introduce these foods and flavors to your children, the faster their taste buds mature, and that they will be a better eater later on in life. And children mimic a lot what their parents do. So with, you know, fussy eaters, it's a constant education to mum and dad as to, you know, maybe you need to all sit down at the table together and eat the same thing. And we need to demonstrate some of these foods. And it can take 100 times for a child to eat food before they might pick it up and eat it. And that's very important too, because you need to keep offering foods for their visual growth as well, for them to try it. So it's about really kind of eating a broad diet and getting lots of, you know, yummy, delicious variety in the diet, and not eliminating anything unless you actually have been diagnosed. You know, if you have a sensitivity to something, then maybe keep that out of the diet. But I'm definitely not about eliminating gluten or dairy or any of those food groups unless necessary. It's about about moderation as well, because if we're having good quality versions of those foods, then a little bit in the diet is absolutely fine.
No, I think that makes sense. I mean, look at us, all of us adults, you know, we have to eliminate this. We are just eliminating, like, you know, all of us, you know, someone has, we have gluten issues, then we have lactose. I mean, most of us have some kind of a, you know, sensitivity, and then we are doing elimination diet. But I think this is the best, what you're talking about is, to newborns, to babies who are born, you know, why eliminate anything? Just give them, I mean, babies, for instance, give them everything that they need to nourish themselves, right? That's what you're saying.
Unless, I mean, sometimes they definitely need to, you know, if there's some sort of inflammatory condition or, you know, for example, you might want to do the elimination diet and then reintroduce gently to see which food might be triggering it, if it is triggering it at all. So, you know, sometimes removing those foods to try and identify if they are causing a problem is the best way to do it.
Yeah. Well, thank you so much. This has been an amazing session. I hope our viewers, you know, young moms or even young dads, it doesn't have to be mom here. You know, the dads also need to know what their babies need. So I hopefully people are watching and then they can help. It helps them. With that, I'd like to wrap up this session. Thank you so much for being with us. I hope you get a better weather there, you know, up the Gold Coast.
Yeah.
Stop raining. Stop raining. Okay. Well, yeah, no, I think, Sandi, that's been really an amazing session. You have so much knowledge, and we would love to have you back on a different topic in future.
Sure.
Yeah.
I just noticed I'm on my Naturally Sandi page, but I do.
Okay.
I put a few more resources on my clinic page, which is Her Earth Medicines. Children.
Tagging you, so don't worry about it. When we do that, we'll be tagging you. All right. Well, thank you so much for being with us.
Have a lovely evening.
Yeah, you too. Bye-bye.
Bye-bye.